We all depend on our eyes to help us drive safely to our destination, work at our occupations, have fun in our hobbies and with our families, and absorb information that is vital to our everyday existence. When we are young, many of us can see everything clearly, from very near objects to faraway objects. But over 50% of people over the age of 60, and quite a few younger than that, have the quality of their vision affected by a progressive eye disease called cataracts. In fact, cataracts are so common, it is said that nearly everyone will develop a cataract if they live long enough. Surgery to remove cataracts is a safe and commonly performed medical procedure. Worldwide, it is estimated that over 14 million lens implant procedures are performed each year. Today, when patients are diagnosed with cataracts, many doctors agree that the time to have them treated is when their quality of vision begins to interfere with doing the things they like to do most in life. And now, thanks to recent breakthroughs in lens implant technology, patients can not only resume doing the things they enjoy most in life, they now have the possibility of seeing like they did when they were much younger.
When I was given the options of the different kind of lenses to choose from, my husband and I both talked about it, but there was not much decision at all. It was pretty easy to make the decision to go with the Rezoom lens. I did not want to depend on glasses. I like the freedom.
Today, patients are choosing to have their vision restored with a second-generation implant called the Rezoom Multifocal IOL that may provide excellent distance, near, and intermediate vision, with little, if any, dependence on glasses or bifocals. In a young normal eye, light enters the cornea, passes through the clear natural lens, and comes to a point of focus on the retina. But as we age, beginning around the age of 40, the natural lens inside the eye begins to harden and lose its flexibility. This reduces the eye's ability to change its focus from near to intermediate to distance and back again. This is known as loss of accommodation or presbyopia, and its earliest symptom is difficulty seeing things up close. Bifocal and even trifocal glasses become necessary for some people to see clearly at all distances. As the natural lens of the eye continues to age, it starts to become cloudy or brown in color. Vision becomes blurry. Driving at night becomes more difficult, and colors lose their brilliance. At first, frequent changes in glasses prescriptions can help, but left untreated, cataracts could eventually lead to blindness. The only way to see clearly after cataracts mature is to have them removed and then replaced with intraocular lens implants, which were first used over 50 years ago to restore vision. Until recently, patients undergoing lens implant surgery received monofocal implants that have only one focal distance. Having monofocal implants in both eyes generally provides good distance vision, but patients often need glasses for near and intermediate vision. Today, many patients are choosing to have the advanced medical optics second-generation Rezoom multifocal lens implant with multiple focal distances. The lens is designed to provide good distance, intermediate, and near vision, so patients are less likely to need glasses or contact lenses. With its balanced view optics technology, the Rezoom lens implant utilizes 5 uniquely proportioned visual zones to provide clear vision for different light conditions and at a variety of distances. For most patients, this translates to greater visual freedom to enjoy daily activities such as golfing, working at the computer, or reading a book, with little, if any, dependence on glasses or contact lenses.
It just adds or I should say, takes away an issue that was dogging me most of my life, which was or a good part of my life, which was having to cope with eyeglasses. And again, given my active lifestyle, but even in general, going to the movies, driving, all the daily activities, the Rezoom lens has just been perfect for me because it duplicates the vision I'd always wanted to have without having to wear the hardware. And for me, that's just freeing and liberating and something that I always wanted to have, and I'm so happy I did it.
Clinical studies show that 92% of all people receiving the Rezoom lens technology never, or only occasionally, need to wear glasses. Surgery is performed on an outpatient basis and typically takes only 15 to 30 minutes. Because the eye is completely numbed with topical or local anesthesia, the procedure is virtually painless. The surgery involves making a tiny incision on the edge of the cornea and gently breaking up and removing the natural lens. Once it is removed, the Rezoom multifocal IOL, which is made of a flexible acrylic material, is inserted in the same location the natural lens occupied. The incision is then closed and remains tightly sealed due to the outward pressure inside the eye. You will be allowed to go home soon afterward, where you can relax and enjoy the rest of the day. Most people can resume their normal activities in a day or so.
It was very simple. There was very little to do on my part. There's no pain involved. The procedure itself is very quick. The recovery for me was going home and taking a nap. Other than having to remember to use drops 2 or 3 times a day, I think I adjusted immediately. The next day I could see better with the Rezoom than I had been able to see before with my glasses.
Everyone heals at a different rate, but in most cases, vision is improved within 24 hours and continues to improve as your eye heals and you become more accustomed to using your multifocal lens.
Probably that evening, I picked up a book to see if I could read. And of course, you know, the medicines that are in your eyes, it's still kind of blurry. But the next morning, just with the one eye, I picked up my book and could read. And I couldn't believe it. I was elated, honestly elated. And then after the 2 additional weeks, I could read out of that second eye, both helping. But I tried it, you know, I covered one eye and then the other eye, and they were equally as good, and I was really excited. When a person depends upon the eyes, there's no way you can express it unless they have gone through the same thing. And those Rezoom lenses honestly took care of the problem quickly. I still talk about it, and then like the doctor said, it's been 2 months on one eye and 6 weeks on the other eye, and I'm still excited. I'm a walking, talking advocate of the Rezoom lens, really.
A visual side effect most people experience is halos or glare around lights, especially at night. The degree of these side effects varies from patient to patient and is most noticeable during the first few months after the procedure. For most people, these side effects diminish over time and do not impair your ability to function visually at night. This illustration represents how a patient saw halos around lights through a multifocal lens immediately after surgery. Notice how the halos significantly diminish over time as the brain adapts to seeing through the multifocal lenses. Most patients report that the ability to see near, intermediate, and distance far outweighs any visual side effects they may experience.
The halos are there, definitely. As I mentioned, I know that they will diminish. They did with my first eye. But I have to tell you that with cataracts, I don't know if everyone is that way, but I was having quite significant halos prior to the surgery. And these were not a lot different, except that the ones with cataracts were not going to diminish. They were getting daily worse. So I definitely think that You know, what I have experienced with the Rezoom lens in the vision and how it has affected my work and my ability to continue working far outweighs any annoyance that I've had with the halos.
Although you might prefer to use glasses for prolonged reading, to read very small type, or to drive at night, most people report they can go to the store or conduct most of their daily activities without depending on glasses. The full benefit of having the Rezoom multifocal IOL lens implant will be even more noticeable when both eyes have been treated, because you will have binocular vision at all distances. If you suffer from poor vision or think you might have a cataract, you should make an appointment to have a complete eye examination. Once it is determined that you are a good candidate for the Rezoom multifocal IOL, you will be given additional information about the possible risks, complications, and costs involved with the procedure. Be sure to have all of your questions answered before giving your consent to have surgery. Although the thought of having any kind of eye surgery can be a bit frightening, it's good to know that such a tremendously successful medical procedure has just taken a giant step forward by providing even greater benefits. The prospect of life with reduced dependence on bifocals and glasses.
When I went back to work after having the surgery and not wearing glasses, people would look at me and say, "You're not wearing glasses anymore. You look younger." And I just said, "Thank you. Thank you, Rezoom."